I am Denzel.
Balik. Go.
Good day, everyone. Good day, everyone. I am Denzel.
Good day everyone. Today we will be performing the occupied bed making. In occupied bed making, the first steps to be applied is to introduce your name, verify the identity of the patients, and explain the procedure. Good day, ma'am. I am Nurse Dan, and I will do your bed. I'll change it with new linen. Would it be fine with you? So, may I know your name? Your birthday, please. Thank you. Next is to wash your hands and wear gloves. So let's assume that I already washed my hands, and then I also wear my gloves, as you can see. After that, let's provide privacy for the patient. Next, to remove top bedding, but before that, make sure to remove anything that is attached to the bed or to the patient. Then loosen the top linen so it would be easy to remove it later. After that, cover the patient with a bath blanket. The purpose of this is for privacy and to maintain the warmth for the patient. If the patient is conscious, let her hold the top edge of the blanket, and if ever the patient is unconscious, just tuck in the blanket at the shoulder of the patient. This blanket will serve as a cover while removing the top linen. Then, slowly remove the top linen or the top sheet. But make sure that you provide the privacy of the patient while removing the top linen. After removing the top sheet, let's remove the bottom sheet and the waterproof pad. But put the patient closer to you to have an adequate space. Move the patient using 3 segments, the upper, middle, and the lower segment. And cross over the feet and position the arms. At the count of 3, slowly move the patients to the other side. Let's assume that we have here the real side of the bed. Just place the hands of the patient. Next, loosen the bottom sheet and roll it together with draw sheet towards the center of the bed. As you can see, I have touched the soiled linen, so I have to wash my hands and wear another gloves to avoid contamination. Now let's apply the bottom sheet. Then now let's apply the draw sheet. Open the hem side, then fold the center fold of the draw sheet. Now let's complete the other side of the bed. What we're going to do is to move the patient to the other side so we can remove the soiled bottom sheet and the draw sheet. We will repeat the process that we have applied earlier in moving the patient to the other side. So let's make sure that we have raised the real side of the bed so the patient won't fall. After that, remove the bottom sheet together with the draw sheet. And after that, we will wash your hands and then wear new gloves to avoid contamination. Then pull the bottom sheet. Just fold into triangle form, then tuck in the excess. After that, pull the draw sheets and let's arrange our patient at the center of the bed. Then let's have the top sheet and the blanket. Then let your patient hold the top edge of the bottom sheet as well as the blanket so that you can remove now your bath blanket. After the process, now we can proceed to our last step, which is to change the old pillowcase with new one.
So that would be all about the occupied bed making. Thank you so much for watching. Once again, this is Denzel Kimenso Fiabra from BSN1B. Thank you for watching.